Dear friends, welcome back to Curious with. I am Dr. Mohsina. In today's video, we will discuss about an important viral disease condition in pigs. So the topic for today's video is Porcine Reproductive and Respiratory Syndrome or PRRS. This disease was first reported in the USA in 1987. Since then, outbreaks of PRRS and successful isolation of the virus have been confirmed throughout North America, Asia, South America, Africa, and Europe. Coming to the etiology and epidemiology, the etiologic agent of porcine reproductive and respiratory syndrome is a virus in the group Arteriiviridae. The virus is enveloped and ranges in size from 45 to 80 mm. Inactivation is possible after treatment with either or chloroform. However, the virus is very stable under freezing conditions and retaining its infectivity for 4 months at minus 70 degrees Celsius, and as the temperature rises, infectivity is reduced. After infection of a knave herd, exposure of all members of the breeding population is inconsistent, leading to the development of a knave exposed and persistently infected subpopulations of sows. This situation is exacerbated over time through the addition of improperly acclimated replacement gills and leads to shedding of the virus from carrier animals to those that have not been previously exposed. The primary vector for transmission of the virus is the infected pig and contaminated semen. Controlled studies have indicated that infected swine may be long-term carriers with adults able to shed PRRS virus for up to 86 days after infection, and weaned pigs able to harbor virus for 157 days, and experimentally infected boars can shed virus in the semen up to 93 days after infection. Aerosol transmission of the virus out to 9.1 km have been confirmed, and environmental factors such as wind direction and velocity significantly impact spread via this route as well. PRRS virus can also be transmitted by fomites such as contaminated needles, boots, coveralls, transport vehicles, and shipping containers. Farm personnel are not a risk unless hands are contaminated with blood from viremic pigs. Finally, experimental transmission via certain species of insects like mosquitoes and houseflies have also been reported. Now let's see the clinical findings of PRRS. Porcine reproductive and respiratory syndrome appears to have two distinct clinical phases. One is reproductive failure and other is post-weaning respiratory disease. Now first we will see the reproductive phase of the disease, which includes increase in the number of stillborn piglets, mummified fetuses, premature farrowings, and weak-born pigs. In this picture you can see a lot of stillborn piglets with the normal piglets. Stillbirths and mummies may increase up to 25 to 35%, and abortions can be more than 10%. Anorexia and agalexia are evident in lactating sows and result in increased pre-weaning mortality of about 30 to 50%. In this picture you can see blue ear disease that is caused by porcine reproductive and respiratory syndrome. Suckling piglets develop a characteristic thumping respiratory pattern. So this is about the respiratory form of the disease in surviving piglets. They develop a characteristic thumping respiratory pattern, and histopathologic examination of the lung tissue reveals a severe necrotizing interstitial pneumonia. So in this picture you can see gross lesion and histopathologic lesion of lung from pig affected with PRRS. That is diffusely motile, red to purple, and rubbery areas of interstitial pneumonia. Then PRRS is capable of crossing the placenta in the third and possibly second trimester of gestation. Piglets may also be born viremic and transmit virus for more than 100 days after infection, and performance after weaning is also affected. Outbreaks of the reproductive form of PRRS have been reported to last 1 to 4 months depending on the facilities and initial health status. In contrast, the post-weaning pneumonic phase can be chronic and reducing the daily weight gain by 85% and increasing mortality to 10 to 25%. Numerous other pathogens are commonly isolated along with PRRS virus from affected nursery or finishing pigs. And other bacteria such as Streptococcus suis, E. coli, Salmonella cholerae suis, Haemophilus parasuis, and Mycoplasma pneumoniae have been reported, as well as viruses like Porcine Respiratory coronavirus and swine influenza virus. Now let's see the diagnosis of PRRS. Serology and PCR. The most commonly used serologic assay to help diagnose PRRS is the ELISA. It measures the IgG antibodies to PRRS virus, and it cannot measure the level of immunity in an animal or predict whether the animal is a carrier. Titers are detected within 7 to 10 days after infection and can persist for up to 144 days. Tests for PRRS virus include PCR, virus isolation, and immunohistochemistry. Nucleic acid sequencing of the open reading frame 5 region of the virus is an excellent tool for epidemiologic investigations in the field to confirm similarity between isolates recovered from different sites. Recently, oral fluid sampling have been widely applied as a means to sample a population of pigs. Now let's see the treatment and control. Modified live vaccines provide partial protection, and currently there are no effective treatment programs for acute PRRS. But attempts to reduce fever using NSAIDs like aspirin or appetite stimulants, B vitamins appear to have minimal benefit. The use of antibiotics or autogenous bacterians to reduce the effect of opportunistic bacterial pathogens have also been reported. However, results have been mixed. Prevention of infection appears to be the primary means of control, and understanding the PRRS status of replacement gills and bows, as well as proper isolation and acclimatization of the incoming stock, are critical measures to prevent viral introduction. Pigs should be retested on arrival at the isolation facility and 14 days later before entry to the herd. Commercial modified live vaccines have been licensed and have been effective in controlling outbreak, reducing shedding, and preventing economic losses. Elimination of PRRS virus has been demonstrated to be possible on an individual farm basis through the use of a technique called herd closure technique. Following successful elimination, strict quarantine and testing programs, the purchase of PRRS virus, naive breeding stock and semen, sanitation of transport animals, and strict protocols of fomite and personal movements between farms must be practiced to prevent reintroduction of virus. In addition, monitoring the status of artificial insemination centers by PCR analysis of blood samples collected from the auricular vein should also be done. And the application of air filtration to artificial insemination centers and breeding herds are very effective means to reduce the entry of virus via contaminated semen and aerosols. So, application of air filtration to prevent aerosol spread. Before ending, let's see the key points of PRRS once again. Porcine Reproductive and Respiratory syndrome is a viral disease caused by arterivirus, first reported in 1987 in the USA and now found throughout North and South America, Asia, Africa, and Europe. There are two distinct clinical phases, reproductive failure and post-weaning respiratory disease, and diagnosis is by serology or PCR. There is no effective treatments, although modified live vaccines provide partial protection against infection. PRRS is most costly disease of the global swine industry, and PRRs can be eliminated through herd closure technique. A comprehensive program of biosecurity targeting both mechanical and airborne risk factors is essential to maintain a native herd status. So that's all about porcine reproductive and respiratory syndrome caused by a virus in the family Arteriiviridae. So if the video is informative, please like it and share it with your friends. Comment your suggestion. If you are new to this channel and not subscribed yet, please subscribe and click the notification bell so that you get notified every time I upload a video. See you soon with another video. Thank you.